person at CrossOver is 200% below the poverty level. So everybody is dealing with economic barriers, every single patient.
When we talk about the poverty diet, Richmond is a city that has food deserts. Our patients, they can get 1 or 2 bags at a time at the grocery store because that's all they can take on the bus with them.
One of the patients I saw, had just gotten to the United States and with nobody, had nobody and nowhere to live, had diabetes and hypertension and just really had zero support, zero income, had been off of medications for a couple of years.
There is a really low-income high school down the street from our cord clinic, George Wythe, and they put a health clinic inside that school because absenteeism was so great, and they're actually diagnosing diabetes at 14.
Most of our patients are dealing with literacy issues and a real issue with not getting the information they need to navigate the healthcare system.
I was diagnosed, my brother-in-law was diagnosed, my husband's sister's husband, and his uncle. We all 3 were diagnosed at the same time. And we all 3 went to the nutritional classes, but that was 11 years ago. I don't have any of that information. I don't know what I'm supposed to be doing.
I mean, we have patients who live 3 miles from CrossOver, and on the bus it can take an hour and a half to get there. It becomes an all-day event to go to the doctor.
And right now, with the way things are, sometimes I don't have but $6 to buy groceries, and I can't buy what I really need to eat. And I mean, it's bad. I have to eat what I can afford, and usually that's stuff that you're not supposed to, like pasta and stuff, and sometimes that's the cheapest way to go when you don't have much money.
But the thing that makes the huge difference is to see the difference in people's lives. There are people who say to us at the free clinic, "You saved my life, I'd be dead now if the free clinic wasn't here." And I think for some cases that's true. Now, the wonderful piece of that is they'd also be dead if they didn't make changes in their lifestyle.
One patient that I think of, she didn't have any health insurance, didn't have a job. She had been having symptoms of being really short, dry mouth and really thirsty and urinating a lot, feeling really tired, and we got her into the clinic, diagnosed her with diabetes. We went over all the things that I talked about earlier before with her, all the huge things in her life she's going to have to change, and she was just overwhelmed. She broke down into tears, and they helped treat her, helped her work on her diet, and over the next 6 months she lost, I can't remember exactly how much, but it's probably about 40 to 50 pounds or so. She, about 6 months later, her A1C was all the way down to I was under 7.
My personal goal for the year would be to educate patients and just have them aware of what diabetes is and the complications and how they can prevent it and the little changes they can make that are going to make such a big difference.
My latest thing is to help me understand why these patients continue to go to the emergency room. They have us as a resource, but something in their mind continues to send a group, not all of them, but some of them back to the emergency. And how can we take those learnings and share them with the community and build programs around what's working?
I mean, I think the biggest thing is just thinking about the individual patients. I'd love to see the number of patients that we have right now that are able to get that high level of case management doubled from where it is right now.
More pharmacists need to be able to do what this project is enabling us to do. Is being able to bring in pharmacists that want to do more patient care, especially in the realm of diabetes. If we are able to have more, even a handful of pharmacists that are doing that and feel good about it and integrate it into the clinics and doing this even in their practice sites, but also in the free clinics, that would be success to me too. Another goal I have is just getting the pharmacists out in these clinics. There's such a need for us. There's 2 of us doing it, and there could be 20 of us doing it, and we still couldn't see all the patients in Richmond who need us. To get pharmacists out into the communities, whether volunteering or working or however it is, and able to help diabetes patients and educate them, I think it's huge.